The assisted suicide issue, I think there's actually some good news, and I'd like to start with that. First, as we were just discussing, Oregon was the first jurisdiction in the United States. In fact, actually, first jurisdiction in the world that I'm aware of to actually formally legalize assisted suicide, which you did back in 1994 by an initiative. And the good news that I want to talk about just briefly is that that initial breakthrough for the euthanasia movement was supposed to open up the Pandora's box, from my perspective, to a sweeping of the United States. Well, you notice that hasn't happened. That hasn't happened. Washington legalized it and Vermont legalized it. Massachusetts voted in 2012 no on legalizing assisted suicide, and Massachusetts isn't exactly the Bible Belt. Connecticut recently said no to assisted suicide. New Hampshire recently said no to assisted suicide, and other states have said no to assisted suicide. So it has not spread like a western wildfire as advocates expected. And it's now been 20 years. 20 years since Measure 16 passed here in Oregon. And that's good news. And I think we should sometimes, and I may be part of the cause of this because I can get pretty doom and gloom, but sometimes in all the darkness that is, I think, in many areas, and my keynote at the end, you'll see the war on humans, there is darkness growing, and there is a terrible threat not only to the sanctity of human life, but the value and moral relevance of human life generally across a wide spectrum of issues. But there is good news. Assisted suicide advocates have not even actually prevailed tremendously here in Oregon because most doctors don't do it. And there's some good news there too. You don't see thousands of assisted suicides in this state, which you would if doctors had said, okay, let's go. You would, but you don't. To the frustration, by the way, of many in the assisted suicide advocacy community. I remember Marcia Angel, who used to be the editor of the New England Journal of Medicine, complaining in print that there weren't enough assisted suicides in Oregon because people were not rushing for the pills. And most doctors do not participate. Many hospices in this state do not participate in assisted suicide. Which makes sense, by the way, because any hospice that participates in assisted suicide, it's as if they also participated in withholding pain control, because suicide prevention is an essential service of hospice. I've been a hospice volunteer. I had the great honor of interviewing Dame Cecily Saunders, who created the modern hospice movement, adamantly opposed assisted suicide. A service of hospice is suicide prevention. So if a hospice participates in assisted suicide, it is not fulfilling all of its role as a hospice. It's almost as if it didn't give a cancer patient morphine because you are not providing that service. In fact, in my training, I was told if a patient ever comes to you and says, I want to kill myself, or I just want to be dead now, you tell the multidisciplinary team so we can intervene and find out what we can do to help change that suicidal ideation. So the hospices that do participate in this state are violating their role as hospices because they're withholding a necessary medical service from their patients. So that's good news. I also think that you don't have to, here in Oregon, be passive. You're not going to be able to change the law anytime soon. Let's also be realistic. But that doesn't mean you can't make tremendous inroads and continue this idea that I think is true in Oregon, as I expressed, that assisted suicide consciousness has not prevailed in this state. I would love to see Oregon Right to Life and other medical groups create plaques that could be hung on a wall in a doctor's office saying, this is an assisted suicide-free zone. You could have, that sends a tremendous message that this is a doctor that believes in Hippocratic medicine, This is a doctor that believes in do no harm medicine. And I think it would be a really wonderful public education event if doctors started doing that. I bet you could get some news stories. Probably angry news stories, but what the heck, right? Saying, if you want to be my patient, you have to understand this is an assisted suicide-free zone and I will not do it. And then if patients say, well, I don't want you as a doctor, well, that's fine. I would also like to see public readings of the Hippocratic Oath, particularly getting groups of doctors together to take that Hippocratic Oath that says, in part, I will not give poisons to my patients for assisted suicide. So there are things that I think can be done in Oregon still, even though you probably won't be able to, for a long period of time perhaps, change the law. And even though the Hemlock Society, which now goes by the euphemism of Compassion and Choices, has doctors that patients can go to that they will be happy to assist in suicides. And in fact, and this is again, I think, the good news amidst the bad news, the fact that that Compassion and Choices is complicit in 80 to 90% of the assisted suicides in this state, meaning they help facilitate them, shows you that Oregon has not swallowed the hemlock in whole. It has in part, but not in whole. In fact, Compassion and Choices issues their own statistics just ahead of the Oregon statistics. It's interesting. What Oregon law really did was gave Compassion and Choices a free rein to help in assisted suicides. So this is some of the good news that I see in this state, and some of the things I think that could be done just in terms of, just like is often done in abortion. You can't change the law about abortion, but there are a lot of babies here today, perhaps a few in this room, who wouldn't be but for the pro-life movement, doing educational services to say there is a different approach, there is a better way. And I think that's going to have to be what we who believe in human exceptionalism, the sanctity and intrinsic dignity of human life, may have to be doing across a broad array of issues as we go along. So anyway, that's the good news. Now I want to talk, as is my usual, you'll see why I'm so much fun at parties. I want to talk a bit about the bad news and the darkness. There is a darkening of Western society that comes out of a lot of areas, and I'll talk a little more about perhaps a few of the causes later this afternoon. But there's a case that still breaks my heart that came out of the United Kingdom, which is another area where assisted suicide, euthanasia consciousness is really making tremendous inroads. And there was a young woman named Carrie Wolterton. And Carrie Wolterton was mentally ill. She was suicidal. She had tried suicide on several occasions. And the way she did so, to show you how self-loathing she was, to try to kill herself, she would swallow antifreeze, and then she would call the ambulance, and they would pump her stomach and so forth and save her. And she'd done this 2 or 3 times. And then in another episode of pitch blackness, she swallowed antifreeze, and she called the ambulance. But she also pinned a note on her blouse that said, "I don't want medical treatment." So they brought her in, the doctors looked at the note, and they said, "Well, we just have to let her die." And they stood aside for 24 hours as it took her to die from swallowing antifreeze. A society that would allow a suicidal woman to direct it, so basically doctors completed her suicide, is a society that's gone badly off the rails. And it's a society that doesn't want me to be heard. It's a society that I think has been crippled by sound bites of choice and has become so relativistic and indifferent to the importance of human life that they would, and the coroner said the doctors were right later, the coroner's inquest, allow a woman to swallow antifreeze, be brought to, call an ambulance. You realize she called the ambulance. And then doctors say, well, we can't do anything about it. Well, if she'd hanged herself, should they have gone, to make sure that she died? Because that's what they did, and over a much longer period of neglect and abandonment. And that's the heart and soul of euthanasia, assisted suicide, abandonment. We don't judge people who get to the place of being in such a state that they want to end it all, but I do think we can judge those in terms of how they react to a brother or a sister's desire to kill themselves. So that's the Carrie Wolterton case. And you see, as we'll go along, that kind of attitude is increasing. In a society in which euthanasia and assisted suicide is generally accepted. And what I'm going to talk about for the balance of our time here this almost hour is what happens in a society that, unlike Oregon, which has, I think, had a significant resistance over 20 years, as I said, to going the whole route. I mean, the terminally ill was just supposed to be the beginning, and if you don't think that's true, I've got a great bridge down in San Francisco I'd like to sell you. It's orange. It's across something called the Golden Gate, and the idea was to get this foot in the door and then have it spread. There are 3 societies so far in this world that have really accepted euthanasia without reservation. I mean, it's not unanimous, obviously, but where the bulk of the people accept the agenda. The Netherlands, Belgium, and Switzerland. The Netherlands started permitting euthanasia, which is, and the difference between assisted suicide and euthanasia to me ethically is like one leg following the other when walking. I mean, there's really no distinction. It's the same agenda, but assisted suicide is when the last act to cause death is done by the person who dies, and euthanasia is the last act to cause death is done by a third person, often but not necessarily a doctor, just in terms of nomenclature. And the Netherlands started allowing euthanasia. It wasn't legal, but it was sort of decriminalized in 1972 after a court decision, how often have we heard that, in which a woman killed her mother in a nursing home, and the woman was a doctor, and she said she did so to end the suffering of her mother. A prosecution was brought, not intended actually to put her in jail. In fact, the expert witnesses from the prosecution said that euthanasia should be permitted. It was not an adversary proceeding. And a judge ruled that this was like a force majeure, where, yes, assisted suicide is illegal, but sometimes there's a higher duty. And they set out guidelines that were soon adopted into law that said that if a doctor followed the guidelines and reported it, among which was to report the assisted suicide or euthanasia, this is active lethal injection, to the coroner, then there would not be a prosecution. And those guidelines included repeated requests, nothing else be done other than killing to eliminate suffering. It was the only other option. That's the force majeure part, and things such as that. Well, since 1973, when this occurred, when this law was passed, Dutch doctors have gone from killing the terminally ill who ask for it, to the chronically ill who ask for it, to the disabled who ask for it, and even to the mentally ill and despairing who ask for it. It has been acceptable to kill, for doctors to kill mentally ill patients since about 1998. The Dutch Supreme Court came out with a ruling, and this was the Chabot case, C-H-A-B-O-T. Chabot is a psychiatrist. And he was trolling, and I use that kind of pejorative term intentionally, for patients at the Voluntary Euthanasia Society in Amsterdam. Now, why would he have to go? Euthanasia was permitted. Well, because once you open the door and say killing is an acceptable answer to human suffering, then the solution of killing is not going to be limited to a tiny little area because you've created a premise. You've said that killing is an acceptable answer to human suffering, and then you've also said that suffering is something that is defined by the suffering person. Well, there's no way to contain what qualifies as a killable person. And so this woman named Tilly Chabot met at the Voluntary Euthanasia Society. She wanted to commit assisted suicide or be euthanized. Did she have cancer? No. Did she have Lou Gehrig's disease? No. Was she a diabetic? No. Her children had died. One child had committed suicide. One child had died of cancer. She was the victim of an abusive husband, and they had divorced. And she now had one desire in the world. She tried to commit suicide and failed. She had one desire in the world, and that was to be buried between her two dead children. She had purchased the cemetery plot. She'd put one child on one side, one child on the other, and the only thing left was to have somebody put her 6 feet under between them. And that's what Dr. Chabot did. He saw her 4 times over about 5 weeks. He never tried to treat her. He assisted her suicide. The case went to the Dutch Supreme Court. Again, this was not to put Chabot in jail. In fact, I met with Dr. Chabot's lawyer, Eugene Sartorius, when I was researching my book, Culture of Death, A Forced Exit in the Netherlands. I went to the Netherlands, and Eugene Sartorius met me. And I'm a lawyer too. Thanks for not holding it against me. And I went out to meet with him, and I really liked him. He was this really very nice fellow, a big, broad smile. I recognized a sharp legal mind. He was Darth Vader, but I liked him. And we talked about this case, and he said, and he represented Dr. Chabot, and he'd said there was never any intention or expectation that Dr. Chabot would go to jail. The issue here was to set a precedent. In other words, the prosecution was to make it so that more mentally ill people could be euthanized. Because the Dutch say it isn't wrong to kill, what we have to do is put it all out in the open. That's their attitude. And so Eugene Sartorius, in the middle of our discussion, he said, "Did you know I've become Catholic?" And I said, "Does the Pope know?" Eugene Sartorius got his way. The Dutch Supreme Court said, listen, suffering is suffering. And it doesn't matter whether it's physical or emotional. And that's logic. In fact, if you know people who are deeply mentally ill, the suffering they experience is often far more extreme and far more protracted than somebody with a physical illness. I did a debate to show you the attitudes that are coming. I did a debate down in Santa Barbara about 3 or 4 years ago against Faye Gersh. Faye Gersh is a big euthanasia advocate. She was one of the big shots in the Hemlock Society. She's not part of Compassion and Choices now, but she's still doing that work. And basically, she'd packed the hall with her people, and this very mentally ill woman got up. You could tell by looking at her. Sometimes people just look like they've just been through the ringer. She could just see the stress and the constant anxiety. And she got up, she took the microphone, and she said, "Why should this right be limited to the people with cancer? I should have the right to kill myself too." And the audience burst into applause. And I was so disheartened. Instead of caring for this desperate woman, people were applauding her suicide if she were ever to do it. And we've actually seen in Australia when a woman named Nancy Crick committed assisted suicide, there was this big, long, protracted time with Philip Nitsky, who's like the Jack Kevorkian of Australia. And people from the Right to Die movement attended her, and when she took the poison, they actually applauded. What kind of a person applauds somebody as they're committing suicide? And she found that when she started to waver all of that support she was receiving backed off. So when she was ready to go forward, then these people came forward and they were there for her. It just shows you the cruelty of this movement. Well, what I've just described is mostly old news in terms of the Netherlands. But let's get into some of the other things that are happening there. Beyond asking for it, there are a significant number of people. It's hard to get the exact number. I've seen hundreds a year. I've seen less in terms of studies. But Dutch doctors now euthanize people who don't ask to be killed. It's called termination without request or consent. And it's not even formally considered euthanasia. And euthanasia has spread to the pediatric wards. Dutch doctors kill babies in their cribs. Babies born with disabilities or babies born with a terminal illness, based on whether the baby has a livable life. In fact, I've seen some studies on this. There have been 2 studies that I know of in The Lancet, which is a medical journal out of the UK. And they found that both studies found that 8% of all infants who die in the Netherlands, not 8% of all infants, but 8% of all babies who die in the Netherlands are killed by doctors. 8%, that's about 90 to 100 a year. The study showed that 45% of neonatologists in the Netherlands have killed babies. And 31% of pediatricians have killed babies. And by the way, the euthanasia level in the Netherlands is age 12. And it gets worse. We are now moving where the psychiatric journals are pushing psychiatrists to euthanize more of their patients. Last year, about 50, I believe, psychiatric patients were euthanized in the Netherlands. And in the Journal of Psychiatry in the Netherlands, they said this is a liberation for both the patient and for the psychiatrist. A liberation for the psychiatrist. I know it's real hard to keep these suicidal people alive. Much easier to liberate both. And the Dutch are very methodical, and they really describe what they're doing. Here's a case that I took from the Netherlands, from their actual published studies of their oversight boards. The patient was a woman in her 80s who could no longer do the things that made life worthwhile to her. She lived on her own. She had always enjoyed intellectual challenges in her life. She used the computer and email. She liked reading, philosophizing, debating, politics, art, and so on. She'd been very independent and considered this her greatest asset. Physically, however, she was deteriorating, and she was getting depressed because she was facing potential incontinence. Her mind was still active. She thirsted for information. The possibility of withholding food and fluids had been discussed, but this would involve a period of dependence. And you see this in Oregon, the idea of dependence, any kind of being cared for, is what leads a lot of people to commit either assisted suicide here in Oregon or euthanasia of the elderly in the Netherlands. She considered it a blessing that she could be put to death by euthanasia, would not have to become dependent. The unbearable nature of her suffering was due to her loss of the ability to live a meaningful life. This is existential anguish. This isn't physical illness. This is existential anguish. And here in Oregon, what the statistics, why do people commit assisted suicide? Fear of not living a meaningful life, fear of loss of dignity, fear of being a burden. How did we become a society where we let our elderly mothers and fathers and aunts and uncles and brothers and sisters feel like they could be a burden on us? That's us. That's on us, not on them. The psychiatrist, the first independent physician to be consulted, noted that despite the patient's poor hearing, he could interview her successfully and so forth. According to the second independent physician's report, the patient wanted to end her life because she was suffering from being alive. The committee therefore must decide whether the patient's suffering was caused by a medically recognized condition. In this connection, it notes that under the existing due care criteria, suffering that is unbearable with no prospect of improvement must be largely due to a medically recognized condition. However, there is no requirement that this should be a serious condition. The committee noted that macular degeneration is a medically recognized condition, so she was beginning to have macula. My mother has macular. And that became the excuse for her euthanasia and was sanctioned by the Dutch authorities. The KNMG, which is the Dutch Medical Association, has now said for elderly, because they are now euthanizing elderly people, quote, tired of life, that the suffering that can justify killing elderly people who are not sick, people who are healthy, is as follows. According to the new guidelines, vulnerability or fragility refers to health conditions and the ensuing limitations, as well as concurrent decline in other areas of life, such as financial resources, social network, or social skills. Non-medical factors such as income or loneliness are to be taken into consideration when euthanizing a patient. And we're talking about elderly people who are not seriously ill or even necessarily disabled. Here's another case of a woman who was a mental patient. Her mood was depressive but not psychotic. She was emotionally unstable, crying all the time and constantly talking about how miserable she felt and how empty, hopeless, and unbearable her life was. This is the suffering of mental illness, there's no question. She had enough of the phasing in of new medication and then phasing it out again. She no longer enjoyed anything. She had no energy or feelings left. She said she had not laughed for 4 years. And this was the grounds for her euthanasia in the Netherlands. In the Netherlands, the KNMG, again, this is the Dutch Medical Association equivalent to our AMA, has issued guidelines that says that if a doctor is asked for euthanasia by a legally qualified patient, and you can see what that means, and doesn't want to do it because of ethical reasons, that doctor must refer to a doctor they know will kill. And this is going to be coming here too if assisted suicide ever actually catches hold in society. The fact that most people in this state might not want to change the law doesn't mean they've embraced assisted suicide consciousness, because, as I said, I don't think you have. 20 years post-legalization. So the KNMG said Dutch doctors have to refer, and if a patient appears that does not qualify for euthanasia, the KNMG has told Dutch doctors they may teach that patient how to kill themselves. It's called auto-euthanasia. Auto-euthanasia. So it's how to commit suicide from your own doctor or your own psychiatrist. And that's what happens when the culture of death sinks into your bone marrow. Being dead becomes much more, if that's what people want, and even if it's not what they want, if suffering is deemed, like in disabled babies, to lead to an unlivable life, being dead becomes the agenda, not taking care of that person so they want to live. Now, it's even worse in Belgium. Yeah, someone's, huh? What? How? Oh, well, I'll tell you. The Dutch took, gosh, what is it, 30 to 40 years to get to where they are now. The Belgians legalized euthanasia in 2003, and instead of sliding down a slippery slope, they jumped headfirst off a moral cliff with enthusiasm and a smile on their face. I want to read to you something I wrote in Newsweek in 1992. June 28th, 1993. It was my first anti-euthanasia piece I ever wrote, and I thought it was going to be the only one, which shows you never know what's coming in life. And it was called The Whispers of Strangers. And it was based on, and this is how I got dragged into this, Father Frank talked about how often stories are what gets us to become activists. And my story was my friend Francis committed suicide under the influence of Hemlock Society literature. And I described that experience in the introduction to the book Forced Exit. If you have it, or if you can find it online. I also, and I know this is online, called The Whispers of Strangers, which was published in Newsweek, June 28th, 1993. If you, in Google, type Whispers of Strangers, Wesley J. Smith, you'll be able to get the article. And I talk about what happened with Francis in more detail, which I won't go into here. But realized that at this time, I was writing books with Ralph Nader. I wasn't thinking about any of this. And so I sat down as I dealt with Francis, and I thought, where is this going to lead? Because I know we're a logical species. And this is what I wrote. Of greater concern to me is the moral trickle-down effect that could result should society ever come to agree with Francis. Life is action and reaction, the proverbial pebble thrown into the pond. We don't get to Brave New World in one giant leap. Rather, the descent to depravity is reached by small steps. First, suicide is promoted as a virtue. I give you Oregon. Vulnerable people like Francis become early casualties. Then follows mercy killing of the terminally ill. From there, it's a hop, skip, and a jump to killing people who don't have a good quality of life. The babies in the Netherlands. The woman with macular degeneration. Tilly, whose children had died ahead of her, and so forth. From there, it's a hop, skip, and a jump to killing people who don't have a good quality of life, perhaps with the prospect of organ harvesting thrown in as a plum to society. Now let's talk about Belgium. Keep in mind what I wrote back in 93. I actually wrote the article in 92, and it didn't get published till 93. In Belgium, they now have almost death on demand. There was a famous case of a set of identical twins. And the identical twins had been born deaf, and they were, as many of you may know identical twins, I've certainly known identical twins, very attached to each other. And they began to lose their vision. And both decided that they never wanted to live if they couldn't see each other. They asked for euthanasia, and they were killed together, laying side by their doctor, who said, in congratulating himself, it was a peaceful death. Elderly couples in the Netherlands now can be euthanized together. We used to think that geriatric suicide was a tragedy, and these joint suicides of elderly people have always been considered a problem to be prevented. In Belgium now, elderly couples can go to doctors, at least a few of them who will do it, and be killed together. And this has happened in at least 2 occasions of which I'm aware. In one occasion, the elderly couple went and picked out their casket and made their final arrangements in their village near them, knew they were going to do it, and supported it, as did their children. Well, if my mother said, I want to kill myself, and I said, okay, Ma, it's your choice, that would really make her want to kill herself. Yeah. They were not terminally ill. They were suffering, they were experiencing the decline of age, but they were not terminally ill, and they did not want to be apart.
So the psychological operandi in Belgium is whatever you want.
Yeah, it's getting to be whatever you want, absolutely. It isn't 100, I mean, if a teenager went into a doctor and said, kill me, that wouldn't happen. But somebody who can be deemed to have other than transitory suffering, I'm afraid in Belgium you're now getting to the place where you can find a doctor who will kill you. Yes. So that's the and by the way, there's so much stuff happening now, I can't even write articles about it. I have to write blogs and even just do Twitter because I can't keep up. My blog is called the Human Exceptionalism Blog. It's on nationalreview.com, the National Review online site. If you go to nationalreview.com, hit Human Exceptionalism, and I write about these and many other issues which are relevant, some of which I'll talk about later this afternoon. There was a case of a woman transsexual who had a sex change operation to become a man. She was very unhappy with the way that turned out and asked for euthanasia and received it. This is in Belgium. She wasn't physically ill. She was unhappy with the surgery. There was a case of a woman who had been a psychiatric patient. She had been sexually exploited by her psychiatrist. The psychiatrist admitted doing it. He was not significantly punished, so she went to another psychiatrist and he euthanized her. So we had a euthanasia by a psychiatrist because a woman had been sexually exploited by another psychiatrist. Yeah, it's just astonishing. And then we get to what I said about a plumb to society. The Belgians now couple euthanasia and organ harvesting. In the first case was a paralyzed woman, completely paralyzed, who asked for euthanasia. They said, well, of course you want euthanasia. And she then indicated to them that she would also like her organs harvested after she was dead. And they said, oh, that's a good idea. And they wrote in and I found this and I've been waiting for this shoe to drop for a long time. And this was in 2008 in the journal Transplant International. This is a peer-reviewed medical journal. The doctors all said what they did. And they said, this case of two separate requests, first euthanasia and second organ donation after death, demonstrates that organ harvesting after euthanasia may be considered accepted from ethical, legal, and practical viewpoints. In other words, we did it, so it's right. There was never any formal statement by Belgian law permitting it. They did it, so it's right.
Plus the patient requested it, so that also...
That's right, and choice. The patient requested it. Well, if the patient requested to be cut or burned by cigarette, should they do it? Who are they now targeting for organ harvesting with voluntary euthanasia? Not the terminally ill, because their organs may be compromised, not people with cancer, but the neuromuscular disabled, meaning people like with multiple sclerosis, and the mentally ill. And they are actually holding symposia where Belgian doctors will say, these are the patients we can go for. This is how it's done, because these have good organs. And then I found a article in a transplant journal about how 4 lungs were transplanted, or 4 lungs harvested, 8 lungs total, but 4 different patients harvested for their lungs and transplanted. 3 of them were disabled with neuromuscular disabilities, and 1 was mentally ill. And this is really ironic. The person who was mentally ill, who asked to be killed and then harvested, was a self-harmer. So this is a person who was a chronic self-harmer, and the solution to that was to kill him and take his organs. Now think about this. How dangerous is it to give despairing, mentally ill, or depressed, disabled people the idea that their deaths have greater value to society than their lives? Because that's the exact message this sends. And how even more dangerous for society to think that. There's a lot of ways to push people into choice, and peer pressure is one of them. And when you think about costs of health care, which also gets rolled into all of this, it's very, very dangerous. So my 1993 article came true. We now have organ harvesting as a plumb to society. I'm told that it's happened once in the Netherlands, but I've not been able to verify that. But we know without question that it's happening in Belgium without a ripple. And where was the organ transplant community? Silent. Silent. They now kill, they've just legalized euthanasia. I've been told I have 5 minutes so we can have questions. They've just legalized killing children in Belgium without age limit. based on whether the doctor thinks the child has enough maturity to make the decision. And get this, the child is required to write a written request asking to be killed. I can't imagine anything more cruel. And I just read this. This was in April 9th, so I guess that's 3 days ago. On my blog, I came across something in the Journal of Critical Care Medicine where Belgian ICU docs have given themselves the right to kill patients who have not asked to be killed, even in the absence of discomfort, to hasten the dying process. So there are no limits in Belgium. Switzerland has suicide clinics. I don't have time to get into that. They do have had joint suicides in the suicide clinics. Just the other day, I wrote on this, February 20th, this was on my blog. A woman from Italy, a healthy elderly woman, went to Switzerland to a suicide clinic because she was upset that she was losing her looks. I mean, I feel her pain. But you know what I'm saying? This is what assisted suicide is, an abyss that has no bottom. And just the other day, April 6th, Swiss assisted suicide for a woman who was flummoxed by the new technology. And she couldn't handle, she didn't like, this is from the UK, a woman flew to Switzerland. She didn't like, she felt technology had taken the humanity out of social interaction. So the answer was to take the humanity out of social interaction by assisting her suicide in Switzerland in a Swiss suicide clinic. And also this will be a little relevant to my War on Humans speech. She also was worried about damage being inflicted on the planet through overcrowding and pollution. So she killed herself to save the planet. And by the way, there's a voluntary human extinction society that seriously wants us gone to save the planet. So, and we can get into Oregon. I've had some ideas on talking about Oregon. You all know about Barbara Wagner. People say there have been no abuses here. Baloney. Barbara Wagner was denied life-extending cancer treatment, chemotherapy. Randy Stroop's in your Medicaid program, which is rationed. And they denied her cancer treatment, but said they would pay for her assisted suicide. There's other things I could get into. I don't have the time to. Vermont just legalized assisted suicide. Their guidelines were based on yours, but they sunset in 3 years, after which there will be no guidelines. So Vermont has probably the most radical law in the world, because in 3 years it'll be just up to the doctor. So this is what happens when you accept euthanasia consciousness, which is why, even though it's legal here, you must continue to fight against accepting it. Because the reason in Oregon there are relatively few assisted suicides is that the full hemlock hasn't been swallowed. People have agreed to say, well, if that person wants to do it, I won't stop them. But they haven't said, yes, this is a positive good. And so you still have the ability to prevent this state from going all the way off the cliff as I described, and I know you will. Thank you all very much. The question is, if we can have mentally ill people euthanized, what's going to stop us from being forced to be killed?
Yeah.
Well, that's happening in the Netherlands, where people are being killed without consent. There have even been stories. There was one story, I think I read it in Herbert Hendon's book, about the Netherlands, and I can't remember the name of the book at the moment, but a nun had requested, she was dying of cancer and she had terrible pain, and a nun had requested that she not be euthanized because the doctor wanted her in the hospital to treat her pain. The doctor said, I will not euthanize you. She went into the hospital, and the doctor went away for the weekend, and he came back and the bed was empty with another patient, and he said, where's my patient? And they said, oh, we needed the bed, we euthanized her. And as I just said, in Belgium, the ICU docs have given themselves the right, in a paper published in the journal I mentioned, to kill patients, even though they haven't asked for it, who are dying, and even if they're not in suffering through overdoses. In fact, let me read to you, I kind of rushed that because of the time factor. Let me read to you what they said themselves. This statement paper developed by the members of the Belgian Society of Intensive Care Medicine Council is not about giving analgesics or sedative agents to combat pain or agitation, nor about so-called double effect. This discussion is about the administration of sedative agents with the direct intention of shortening the process of terminal palliative care in patients with no prospect for a meaningful recovery, which is a hugely loose word. Shorten the process of terminal palliative care. Killing! It's killing. It's not shortening anything. It's killing. And so they've given them that, and then they, as I said, even in the absence of discomfort, so a patient may be dying a natural death, not in pain, everything is controlled, they can kill them anyway, shorten the process, and it applies to children. So, sir, it's already happening.
Kids don't need to get...
But they're going to be less wanting to actually do the act of killing than they do assisted suicide.
Yeah.
Let me tell you what the Dutch have done. The Dutch doctors find one of the regulations in the Netherlands that actually has stuck is that the killing must be done by doctors. The only case I know of where somebody euthanized a patient against their will or with their will who went to jail in the Netherlands was when a nurse euthanized a patient, which is not permitted, and she did 2 months. 2 months. But the Dutch doctors find it very, as you can imagine, stressful to actually have to go and kill people. So what they're doing now, and there's been a huge increase in this, is what's known as terminal sedation. I'm not talking about palliative sedation, where sometimes there's a legitimate palliative situation where people are close to death and that they have to be put into an unconscious state to prevent suffering. That's a legitimate palliative technique that's needed in 2 or 3% of the cases, and it can be titrated so people can go up and get more into consciousness than go down, just to, like if there's severe agitation. This is terminal sedation, which puts people in an artificial coma, takes away food and water until they die, and the doctors don't have to be there for that. About 10% of the cases of people dying in the Netherlands now are terminal sedation. It's not considered euthanasia. So the Dutch, and the doctor doesn't have to be there.